Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse focused in the area of advanced illness, typically those that would qualify for either palliative care or hospice care. Those are two separate services. I'm also a certified end-of-life doula through the International Life Movement, an educator in end-of-life topics, and I'm the owner of Compassion Crossing LLC, operated in Kentucky. If you're new to this channel, welcome. Thank you so much for taking the time to visit. In this channel, we talk about issues related to death and dying. After all, we are all going to die. Shouldn't we be more prepared for what we're facing? Death comes to everyone. In my research and the research of many of them out there, scientists, peer-reviewed articles, etc., the science shows that if you prepare for a good death, we're not talking suicide. We're not just talking your funeral. We're talking your living will, and have your plans arranged for how you want to die when the time comes. You're more likely to have that good death versus winging it or spontaneous. Are you aware that in the United States of America, the average length of stay for hospice is 18 to 21 days, 3 weeks or less? The benefit is 6 months. Shouldn't we take advantage of the 6 months? Especially when studies show that those who are admitted at the 6 month mark have the potential to live an extra 30 days. Hospice doesn't make anyone die faster. If topics about end of life, death, and dying for hospice nurses, holistic nurses, caregivers, end of life professionals, including doulas, are of interest, please consider subscribing and hitting the bell notification below and like the video. It helps small channels like mine with the YouTube algorithm. The topic for today's video is going to be an article that I published on Monday, September 8th, 2025, about how hospice is facing multiple crises, and one of them being new nurses being afraid of death and dying. In my last video, I talked about how one of my fellow hospice nurses, who is going to the International Life Movement, I believe she's part of cohort 26, I graduated from 25, that she mentioned that she was doing continuous care. So that's being part of that's the one time where hospice will staff a home, personal care home, assisted living. They typically don't do this in skilled nursing, certainly wouldn't do it in a hospital setting. That's the one time where hospice staffs for blocks of time. So she's there as the hospice nurse, and there was a nursing student who just couldn't face the dying process and ran out. This sadly is beyond common. So I want to talk about this in today's video. The last video that I did is about how morphine doesn't hasten death. So this is on the same genre that hospice is a blessing for those that get a good agency. And yes, I wish there were no bad actors out there, but there are. So before we get into the topic of today's video, I want to ask you, what are you grateful for? I believe there are 3 pillars to building resilience, the ability to handle tough situations that happen in life. In this channel, I look at the 3rd pillar, gratitude. What are you grateful for? So I'm grateful for every one of you that take the time out of your day, wherever portion of your day it is, to watch my videos. I'm thankful for those of you who are buying my books. I'm thankful for Anna Adams, who I believe the International Life Movement and NELDA are part of the answer to what we're going to discuss. And she allows me to advertise my books, promote my books in the movement to help my fellow end-of-life doulas. So I'm grateful for that. Now, getting into today's article, and by the way, this is love art. I am not a graphic artist. But it's a combination of love art and Canva, because love art, Lovart, had an issue getting IDLM, that's the International Life Movement, on their scrub tops. And I'm not going to go over every point of this article because I'm going to put a link in the description below for you to read. For those of you who read my articles on compassioncrossing.info, you know I tend to be extremely thorough covering the different points. But I do want to hit some keynotes in this video. So this is beyond uncommon with the impact when a nurse fears death. You avoid the meaningful conversations. I shared in my last video that when I asked why was I getting more and more hospice patients when I worked in cardiology, and the answer I was told was complimentary, but I thought I was doing the standard. Like, I didn't think I was exemplary, but they said, Peter, you're very patient with the families and everyone coming in. You take the time to answer their questions. I still don't understand why that would not be the standard. But, when I did this article, well, doesn't it make sense that if you're afraid of death and dying, you're not going to have conversations about end of life wishes or comfort care? You're going to rush through the visit to avoid your own emotional distress. You're going to struggle to support grieving families and more burnout. When I worked for a Care hospice, I mentioned in the last video, and several others, I've worked for them on 2 different occasions. I do my best not to burn bridges. So I worked with them when they were owned by a Golden Living and again went under emeritus. But when I left after 2 years, and it wasn't for what the person who told me this, and I don't want to name them because they are somebody that I'm weird. I look up to this person, and yet they have traits that I pray, at least in 2025, are very different from when I last knew this person. They're a wonderful mentor. They have beyond excellent clinical skills, and they are an excellent hospice nurse. I still remember when they were precepting me. They're now I don't even want to say what their position is because that would be easily to identify them for anybody because the York office is small. I believe that's the case still in 2025. But I still remember the case where we went out and I forgot my blood pressure cuff. She forgot her blood pressure cuff. I did on my stethoscope. But she ended up using her hand to create the equivalent of blood pressure cuff and listened and was able to gauge the blood pressure. And based on the family keeping track of previous, I was blown out of my mind. I'm smiling now because I still have that vivid memory that she was that good. But she was the one negative. She micromanaged to pieces. And on top of that, um, she would try to manipulate you into taking on call. Like, I don't want to mandate, so I want you to sign up. And if you signed up knowing inside that that was the wrong thing because you were going to get something that you were not uncomfortable with, well, you shouldn't have volunteered. It's like, oh my. So I left after 2 years. She said, "Oh, it's everyone burns out after 2 years in hospice." And it's like, that's its own rabbit trail. But here, there are references in the resource section where I back up the data. But hospice agencies, 35% of hospice agencies, staffing is their greatest challenge. Right now in 2025, and it started earlier than 2025, the nursing shortage isn't just the hospitals and nursing homes, it's hospice agencies too. And the pressure because of that, and I'm so thankful for Shelley and Adam Henry of the Amity Group. They are I think the only staffing agency in America that staffs strictly for hospice. And Shelley and Adam speak at different conferences throughout the United States of America promoting safe staffing. promoting doing hospice the right way, promoting interdisciplinary communication. I cannot speak highly enough of Adam and Shelley Henry of the Amity Group. They are amazing, and they do so much to help the industry. Even so, there's many nurses, and I've been here. I still remember a Sarah Care, and I forget whether it was the first time or the second time. I had a caseload of, it fluctuated between 29 and 30. Can you imagine 29 to 30 patients where you're supposed to, best case, some of this is my opinion, just putting it out there. Medicare's rule, CMS, Center for Medicaid Services, a hospice nurse, LPN or RN. Now there are for the RN higher requirements. The nursing visits, good. If it's only going to be one, it needs to be the RN. Once every literal 14 days. A lot of agencies are, well, we'll come once a week. Too short of time. I believe the absolute minimum should be twice a week. And then if they're having symptom management burden, not requiring continuous care, but close, at least 3 times a week, maybe 5. And if they're in the last 2 to 4 weeks of life, 7 days a week. That's me. But so imagine you have 18 to 36 patients. There's 8 hours in an 8-hour workday. I know there's 24 hours in a day, but you got drive time. So imagine, like I covered York County. This is back when I'm in Pennsylvania. I'm living in Kentucky now. So my drive time, they would try, Sarah Care and Grain and the different agencies and Lifesong Hospice, they would all try to have the drive time between patients to be 15 minutes to a half hour. But in reality, the average was probably 30 to 45 minutes, 45 minutes being more common than not. I would have patients that it would take me 1 hour or a little bit longer to get to one way. That would not be uncommon. So imagine, how many patients can you see to spend quality time? My average length of stay, I shouldn't say length of stay, my average visit time, because the home care, home base, drive time, in-home time, documentation time, outside of admissions. So I would document in home, outside of admissions. So my average time in home was 1 hour and 15 minutes to 1 hour and a half. So I would range from the 45 minutes on the short end to maybe 2 hours on the long end to give you that average. A lot of my colleagues were 30 to 45 minutes. Some were doing 15 to 20 and then making it up by documenting. That's its own rabbit trail. 18 to 36 patients. No, I'm not able to see. When I had 29 to 30, I go to the interdisciplinary group meeting and Dr. Eric Barr, can you tell me about so-and-so? Well, doctor, I haven't seen the patient since they've been admitted. Well, Peter, that was 6 weeks ago. The meetings are every 2 weeks. Yeah, and other nurses have been seeing them because I have 29, 30 patients. I'm seeing the most critical, but like there's only so many hours in a day. So other nurses, PRN and so on, were filling in the gap. And then I'm having to go by their notes, and not everybody's documenting consistently. That's part of the reason why I wrote my book, Mastering, compliance driven, or the compliance-based eligibility-driven hospice documentation, to try to get everybody to be on the same page. And the Amity Group has the DAHN app for both iOS and Android, the DAHN app, to help with consistent documentation. But really, the best case is 10 to 12, 15 kind of pushing it if you want to do justice. So here, less and less nurses out there, more and more of them are coming without any training. I mentioned that when, in my last video about the morphine, I mentioned when I went to Harrisburg Area Community College, and to me, wonderful school. I felt beyond prepared for my NCLEX that I passed the first time. I don't know what it is in 24, 25, but when I went in 20, I graduated in 2016, that had 98% first time pass rate. So students that went to their Lancaster or Harrisburg campus had a 98% chance to pass by going to their school. And so, but here, all that was covered on hospice was one page, just the front on the history of hospice, and one paragraph on multi-organ failure. The schools do not teach you hospice. They're about comfort care, death, or dying. Everything in nursing until hospice is focused on rescue and maintain. Rescue no matter the cost. Rescue no matter the harm. Rescue at all cost, and then maintain without regard to comfort. And so nurses, and this includes doctors and other healthcare professionals, are not trained in end of life. Not trained in end of life. So there's a crisis. And so the research shows that death anxiety is a real thing. I mentioned just the week, literally today of the date of this filming, Monday, September 8th, Summer, fellow hospice nurse, is writing on my Facebook page. She had a nursing student leave. We're not talking patient abandonment because this is not a working case, but leave because she was afraid, he or she was afraid of death and dying. We need to do better. And I believe there's an answer, which I hopefully address in this article. So the research out there shows that when the staff is not properly trained in understanding death and dying, that there is nothing to fear. There is nothing to fear. We have a catastrophe coming up. You know, Summer correctly pointed out, this is the generation of the nursing student that ran out. That might be the person taking care of Summer and I and my wife. Not saying the exact person, but like, do we really want that? Or do we want better for ourselves? So the staffing shortage, this again goes over staffing, the mentorship gap, and I am hoping, I haven't heard from Dr. Ben, but I completed my draft, for lack of better words, called Beyond the Flip. I'm doing a keynote speaker in March of 2026, a hospice and palliative care conference in South Carolina, given 15 minutes to talk about interdisciplinary communication, looking at hospice admissions. And when you talk about the mentorship gap, I still, as much as I admired my first mentor in hospice, the mentorship is short, and then you're thrown in, and then you're handling so much on your own. And yes, you can pick up the phone and call and hope the other person's not in a meeting and not doing this and that, especially if that you're dealing with a crisis. But there's a gap. And I believe that gap, and I'll link the article, and the cost of that gap is huge. And part of the reason why I wrote my 21 books, each of them dealing with a specific topic, like here, I'm thinking of, I have two books that come to mind for here. The Complete Visit, like what makes a complete visit in hospice by a nurse, that you reduce all this out, the stuff that can be addressed, and the art of visit planning for planning your scheduled visits as well as your PRN visits, so that we can reduce all of this, that we could fix the problem before it becomes one. But let me move on. I believe education is so critical. We're coming to the landing zone because I don't want to, I'll give you the link. But there's specialized training available. It's already out there as of today. At the time you're watching this, the answer is present. This is not something that has to be done and they'll take months to do or years to do. The answer exists today. And that answer is through working by hospice agencies connecting with competently trained end of life doulas, whether that be myself, because I am also a I have my Kentucky and Pennsylvania license. I am a hospice and palliative care trained, bachelor trained registered nurse who's also a certified end of life doula. So either working through individual doulas like myself or through schools that have proven themselves beyond doubt that they are good. And to me, there are two that come to mind. And that, yes, there are more than two. And please don't be mad at me for not including you in a laundry list of schools. Please, I'm not trying to miss out, but I do know from my own homework, there is a school out there that was founded by a hospice and palliative care nurse um, that has a lot to be desired, and I'll just leave it at that. But I believe that there are two schools that have proven themselves. There's the International Dual Life Movement that's founded by Anna Adams, over 25 years of experience with hospice and end of life care. With the International Life Movement, what makes them extremely unique is they have on-site training in several states. Several states in the United States of America, they have on-site training. Texas, New Jersey, and my short-term memories like this, I don't have the laundry list memorized. I'll include links below. But they offer on-site training. They just made an arrangement with Quinlan Hospice out of New Jersey. They have on-site training, hands-on experience. They have live classes, and this is one of the things that really, really separates them from the competition. A lot of doula schools have pre-recorded webinars for you to watch, PDF handouts for you to read. Live sessions allow for interactivity. And every last instructor, and they can't guarantee it for every single class, but every one of their instructors, number one, has their feet on the ground. They're practicing. So it's not like somebody that retired and they're teaching. They're practicing and they're teaching. The courses are updated every semester. So every semester they're doing a debrief. What could they be doing better? So there's no stale material. And when you take a class, they're giving you their mobile cell phone number, their email address. Text them before you call. They'll put your number in their contact list so that they can take your calls or get back to you if they're dealing with a client emergency themselves. And they'll stay in that live session after class if you need to talk. The International Life Movement was the first end of life doula school that requires continuing education in order to stay certified. Other schools are now catching up from what the International Life Movement started. And their continuing education, 99, close to 100% of the time, is free. Now and then they will charge, now and then, but the majority of the time is free. So I started being in charge of continuing education development in May of 2025. I started off in doing my first presentation let me see, June was hospice eligibility, July, how dementia is different for hospice eligibility, but looking at hospice eligibility. August, we actually did 2 sessions, what is palliative care? And then the second session, transitioning from hospice to palliative care. All of those were free to students. Then in October, okay, before I go too far, September, the end of September, there's HIPAA and privacy for end-of-life doulas, free for students. I don't know from Anna if she's going to allow me to offer it outside of the students. When it's offered outside, it's typically $10.95 per person. Uh, but then come October, I'm going to have one in October. I'm going to have one in October, which is going to be Canva for marketing and businesses for end-of-life doulas. And I don't know when. There's going to be one on combative patients, and I've done polling on this. But October, we have, give me one moment here. One moment. Oh my word, my picture's in the way of the screen. Penny Clement. Penny's going to be doing a continuing education on end-of-life doulas, working with social workers and she's going to have on a panel audience for the second one, looking at the four major religions in the world. And granted, for me, I believe faith and religion are two separate things. That's a separate discussion. But all of these the majority of them are free. What Penny's doing is free education. So International Life Movement, wow. And granted, I didn't have, I did put here, but I do have fears of death, not my own. I wasn't sure how to best write this, but I was dealing with when I die, my spouse, and that's what a lot of the students had to deal with as well. And the other thing to note with live classes, there's so much depth because your other students, like if you have a question you're afraid to ask, somebody else is going to ask it because they probably have the same question you have. And so there's so much depth and breadth for that. And a lot of the other schools are pre-recorded webinars. There's a difference. And yes, IDLM does self-paced, but they really recommend on-site or live. Practical skills and support. Oh, before I forget, Sunday the 7th, we're on a monthly membership call. So Anna typically leads as one of the, I'm a part-time instructor. I'm on, sometimes other instructors are on. A lot of doulas. There's a number of end-of-life groups on Facebook for doulas. And a lot of them are crying, I need a mentor. I need a mentor. We talk about the hospice nursing students, nurses, hospice nurses, you need a mentor. IDLM, mentorship is free. Then there's INELDA, the International End of Life Doula Association. They've been 2015. They're extremely well recognized, and there are other options as well. But I strongly would encourage. Let me go ahead to, again, I'm going to link this in the description below. But here, if you get out there, if you're working in hospice, if you're working in education, please connect with your end-of-life doulas. Ask them where they got their training. Connect with their schools to validate. Make these connections and start looking at whether it be working through the International Life Movement or the International End-of-Life Doula Association. Have them start training your nursing students. Have them start training your nurses. Have them as part of your hospice orientation. Have them as resources after orientation. I thank you for your time. God bless.